so that we don't all increase our cardiovascular risk or cancer risk, why don't we stand up and have a stretch? Shouldn't really be sitting for more than 25 minutes at a time. We've broken that rule several times this morning already. Need healthier work patterns, eh? All right, good to see you. Please take a seat. I've been given the task of standing still, which is going to be a miracle. Learning from vanguards. So yes, Morecambe Bay was part of the Vanguard programme through NHS England, and I'm just going to reflect on some of the lessons that we've learned, some of the good things that we've learned, and some of the challenges that we've come across, and kind of how we take those lessons into the future together. So my name's Andy Knox. I'm a GP, so 2 days a week I run clinics, and I'm very much at the coalface of working with people in our communities, and then the rest of the time I'm the Director of Population Health around Morecambe Bay, trying to work as much with SACTHI in a very joined way across the ICS as we can. So, some real positives have come out over the last few years, and I can't emphasise, on your tables there's 4 circles of learning that we took from the IHI about 3 years ago and have really tried to embed into our system. And the first and foundational thing, if we're really going to bring proper systems change, is you have to get culture right. We know that culture eats strategy for breakfast. We know that it does, but we still spend 90% of our time thinking about strategy and how we're going to implement it, and very, very little attention to how we really focus on culture. And building culture is absolutely vital to getting population health embedded into our systems. And we talk about 3 aspects of culture in Morecambe Bay. We talk about a culture of joy. That sounds nice, doesn't it? How do we build cultures of joy in which actually people love working together? And it takes trust, it takes vulnerability and openness and honesty from leadership. And it takes trust and knowing that you belong and that you are loved and that you have a shared purpose and vision in your teams. And I would say over the last 3 years, I'm really proud of the culture that we've started to develop. And it takes time, it takes enthusiasm, it takes evangelism, it takes real hard work and guts and determination to, in the midst of the pressures that we all are working under, to transform culture and have it so that we all believe in the same way of working together. And I would say that as a system, we have really owned population health, and it's in our leadership team at every level. So our Director of Commissioning and our Director of Finance, and especially my friend John Glover and the CIO of our system, really believe in and get population health. It is on our lips, it is what we are about. There is no other game in town for us. And you might say to me, well, at your appraisal, how many heart attacks have you saved, or how many strokes have you saved? And right now, honestly, I don't know the answer to some of those questions. But what I do know is that we have spent 3 years, and it takes time to do this, building a phenomenal culture and ownership that this is everything that we have to focus on together. Secondly, thirdly, it really takes great relationships with partners. So we absolutely are desperate because we all are in the same boat in terms of resource allocations and things that are happening, and we need each other like we've never needed each other before. And we need partners from across the political spectrum. Vital that we work with our politicians because they have an incredibly hard job to do in terms of working with their constituents and really some of the issues that are being faced in communities. It's vital that we work with public health colleagues. It's vital that we work with the acute providers and with the police and with the fire service and with and we have spent a lot of time building partnerships and sharing the same vision and making sure that we're in the same boats together. So our health and wellbeing partnerships are very, very strong around the Bay, and there's a real sense of unity so that we are tackling the social determinants together, as well as really focusing on the population health management. Grassroots initiatives and building a social movement is absolutely vital. And again, that takes time. And it takes hard work, and it takes determination, to meet with key people in the communities and then open up conversations in which you invite people into those spaces, and to learn how to hold really good conversations, to hold spaces open in which communities can come together and actually express some of the anger, some of the frustration that they feel, be given the space to tell some of the stories of what it feels like to live in their communities, and then recognize the same pressures that we're under, and as we share those frustrations together, actually being able to say, so we're all in this together, so how do we actually build a community that is healthy and well? And that takes time, but it is the second principle from the IHI. And if we don't build social movements around population health, we won't achieve anything. So we have to take our populations with us. And some of that is about getting the digital stuff sorted and communicating well, but some of it is the dirty, everyday communication and bringing communities together for conversations that really matter. Grassroots initiatives. I could tell you story after story after story that as a result of these conversations, we have seen amazing things happen. I could tell you the story of Liz Kendall, a head teacher in Carnforth, who in the last 2 years has lost 4 stone as she has started to run a mile every day with the kids in her school. And in fact, now she doesn't just run a mile in the mid-afternoon. And by the way, her SATs results have gone up through the roof as well, especially in maths for boys who are able to now concentrate in their classes far better because they're not all over the place. They've actually been able to settle and focus. But she actually runs a mile every day before school with her staff to connect with them and to debrief with them. So she's now running 3 miles a day. And she has gone, I honestly nearly didn't recognize her when she walked down the street past me the other day. She is a totally transformed woman, and she's become one of our greatest evangelists of running a mile every day in school. I could tell you about a school in Morecambe where they recognise that there's major issues with food poverty for children, and they are now running food clubs every morning before school to make sure that kids get a really good breakfast before the day starts. They're giving them incredibly healthy lunches, and they're running cooking clubs for parents so they can learn how to cook healthy food for their kids. I could tell you about the way that we're taking a population health approach to adverse childhood experiences. I could talk to you about a woman who is a patient of mine who lives every day with bipolar and who recognised that mental health service provision in the community was poor, and what she wanted to do was connect people together relationally, and she took it off her own bat with just a seed fund of £500 from us to start a mental health cafe. And the transformational stories that have come out of that, where people have told us it has literally saved their lives. It's incredible. The social movement that we're beginning to see and the initiatives that have come from communities saying, this are our problems, this is what we want to do together. And with a tiny bit of resource or a little bit of encouragement or some enthusiasm from people working alongside them, we've begun to see communities change life for the better for themselves. And I could tell you honestly countless more stories, but I'll just leave it there for now. The next thing is that we've built population health management into every pathway redesign. Now, this is what I mean by population health management for us. So we have designed our Pentagon. I am so grateful to have an amazing public health consultant, Jane Matheson, working alongside us. You know, population health is the little brother of public health, and we must not lose the expertise and the phenomenal wisdom that comes through the training that is public health. It is incredible, the depth and the breadth and the analytical wisdom that comes through our public health colleagues. And Jane has been a great champion for us, as has Sakthi and Colin Cox in Cumbria as well, bringing such wisdom into how we think about population health. And Jane, with Vicky Hepworth-Putt and with Hannah Maiden, 2 of our SPRs in public health, and with our business manager at UHMB, Marie Spencer, have created this. And this has helped us really frame how we have redesigned every pathway in Morecambe Bay. So for example, when we are redesigning our work around diabetes, we held a huge workshop at the time, 70 people in the room, 30 of whom are people who live with diabetes every day. So when we talk about co-design and co-production in Morecambe Bay, we really mean it. We get people into the room from the very start who live with that condition every day. They tell us some real home truths about how good or how bad their care is, and really knowing your people is so important, because what will work in Barrow might not be the best solution in Ulverston or in Carnforth or in Morecambe, but it's got to be bespokely delivered, even though we want to affect the health of the whole population, but we want to work with communities where they are in terms of what they want and what they need. And then we've talked about the power of people movement. There are challenges, though. It takes time. Yes, there are quick wins, and yes, there are things that we should be getting on with, but it takes time to build trust. It takes time to build trust with your partners. It takes time to build trust with your leadership team. It takes time to build trust with your community. It takes time to change culture, and it takes time to develop pathways that are smart and intelligent and make sense. And if you're not willing to invest time and you think that you can do it like that without really engaging with your communities, without really bringing your leadership team on board, you're on an absolute hiding to nothing. And I get asked this question a lot, and it's a difficult question, so you have to develop broad shoulders and you have to learn to be brave. Are you achieving anything? I think we're achieving loads, and actually, for example, if you were to apply our Pentagon, which has been right through our respiratory network, we are now saving 50 to 80% of outpatients appointments and admissions in respiratory over the last 12 months simply by taking a population health approach. So yes, we have some good outcomes, and I'm really proud to be able to come back to our leadership team and say this stuff is really beginning to work. We have to talk about the elephant in the room, which is resource. It is very, very difficult. We have to save a fifth of our budget in the next 3 years. Okay? It is very difficult to save 100 to 120 million pounds and do transformational change with your population at the same time. It's not impossible, but it's difficult. And actually, there is going to need to be, as this new finance agreement comes through the NHS, a concerted decision that some of that money that's coming will be about delivering care and putting stuff into a population health approach. We need to break through our organisational and contractual silos. That takes bravery, and we need to take everyone with us. Now, taking everyone with us is harder than we think, and it takes time and energy. So moving forward, building a strong foundation is absolutely vital. I think we've got a strong foundation in Morecambe Bay, and I think we've got a strong foundation right across Lancashire, because it is a brave choice to make. There's got to be community ownership, strong partnerships right across the board in the public sector, private sector, and community voluntary sector, who are our very best friends. And it's got to be locally embedded. So what's our focus moving forward? Intelligent IT. Continuous learning and making sure that the provision of care is as excellent as it possibly can be. Making sure that we're delivering new pathways co-designed with people who use those pathways every day, but making sure that we are closing the gap with the very best help from Right Care and others. Putting the focus, the shift towards prevention and detection, turning the taps off rather than wiping the floor, as we've heard from Surrey, and making sure and being utterly committed to tackling health inequality. There is a great danger when you work with communities that you work with communities that are already mobilised, already have self-efficacy, and already want to be making a difference to their own health. And there's a danger when we talk about population health that we could make health inequalities worse rather than better. That takes leadership, it takes bravery, it takes guts. It's going to mean that we're going to achieve something together that no one else has actually achieved so far in the last few decades of talking about this. We have to close the inequality gap. And that takes everyone being on board together. So in summary, my favourite hashtag is Together We Can. We can't do this alone. We can't do it in silos. We can't do it in our different ICPs. It is together across this ICS that we can achieve some phenomenal things together and lead this country into a new future in understanding what population health really means.